Okay. If you want, we can kind of, my question to her on the earlier was the status quo, because there's nothing in Louisiana. And so I was like, well, I feel like that's going to be a hard way to say it. And she was like, just say there's nothing, basically. So for our status quo, like nothing, no formal legislation or regulation exists in Louisiana for staffing inpatient hospitals.
Yeah, I didn't find, nothing obviously for Louisiana. I did find in that document again that I was talking about last week, it referenced some of the things that she was looking for. Let me get out my paper here. So policy alternatives and the literature you have found in similar efforts in other states. So in that document, again, it was this nurse staffing, optimal nurse staffing to improve quality of care and patient outcomes, and that was through the ANCC, and it was just documenting some information of states that have enacted legislation or adopted regulations addressing nurse staffing. So one of the alternatives could be to modify the current policy, which I guess we'd model off of California.
Which we talked about kind of making it pretty specific. That way, when we talk about political viability, like the evaluation criteria, we could talk about like it's really strong, but we could, cut out department. Mandy, you want to tell her what we were kind of thinking?
Yeah, so we were thinking for like the true like policy that we're gonna exactly what you were just saying. So have like kind of specific to units like ICU across the board, whether it's PICU, NICU, 2-to-1, and then unless it's like a true patient requiring like 1-to-1 who's sedated, or like a transplant patient. But I don't even think you need to like get into that. I think 2-to-1 should be for critical care all across the board. And then kind of like 1-to-4, 1 nurse to 4 patients for pediatrics, telemetry, like step down units. I'm looking at that. I printed it today too, the one that you were just talking about. So what was the other one? I think we said ER.
Telemetry, peds, ICU.
Yeah, but being like specific to, like the bigger units, and then like med surge, one nurse to 5 patients, I think is what California does as well. What are your thoughts on that?
Yeah, I think that's good. So we would tailor California's regulations to propose something for Louisiana in those regards with the ratios.
Right. That would be like our proposal, I guess.
Like our first like alternative, yeah.
Our first alternative. And then the second alternative kind of models, I think this is kind of what we talked about last week too, models similar to what Illinois is doing. So the law in Illinois requires hospitals to create a written hospital-wide staffing plan. So it takes into consideration acuity, complexity, volume of patients, discharges, transfers. So I think that this kind of goes along to what we're talking about with like the rural hospitals in Louisiana. Like, does I'm gonna call it the California ratios really work for our state, because we have so many rural facilities? Would something like this be a better alternative, because you're actually able to look at more of the volume, things like that? So in addition to looking at all of those things, the hospital has to have a committee that's comprised of 50% nurses who actually provide direct patient care. So not just like a nurse manager or like a case manager who's a nurse. Like, it has to be patients, nurses actually providing direct patient care. And they're part of the committee that creates the staffing plan and makes recommendations. And then we had mentioned a lot of other states also have to disclose and report to the public what their ratios are, and so basically having like full disclosure to the public and reporting.
Like accountability. I mean, if you can't, if like DHH can't go in and hold them accountable, at least public, publicly disclosing would be like, hey, if they have, 10 patients to one nurse, I'm not going there,
Exactly.
Right.
So I think like including those two things as the other alternative probably would work too. So I feel like you'd be able to really talk to both of, because one is pretty strict and pretty like, this is it, and then the other has a lot more leniency that you can actually work with.
Was she didn't require how many alternatives that we would need.
No, it's just the status
it's three.
quo alternative you were recommending and another feasible alternative. So
it's two.
Yeah.
Yeah, because I was also looking at that. This was like page 21 of that document where, everything you're just saying with the ratio.
Which we pretty much like, that was kind of like our initial group suggestions, basically those two, right? Like,
yeah, the committee was interesting. Ohio, I think it's Connecticut, Illinois, Nevada, Ohio, Oregon, Texas, and Washington. So there are quite a few states that already have developed that. So that might be a good.
So are you, Jessalyn, because you're a DON, right? So how are y'all, do y'all have patient ratio requirements for you?
Yeah, we have 1 to 7 if they're I'm in detox and rehab, so drug and alcohol. So our accreditations are through not the Joint Commission, but through CARF and DDAP, which is our state regulatory agency. So they require 1 to 7 for detox patients, and then rehab and residential rehab, it's their chronic conditions, chronically managed at that point, so it can be a lot higher.
Right.
A lot of it
they have like a specific number for y'all.
1 to 7. I mean, we have on my units, there's a male unit, a female unit, so we have 2 nurses, 57 patients.
Gee whiz.
So the ratio would just have to be 1 to 7 for the detoxers.
Okay. Because we were talking about LaDaria, I don't know if you know, but like, how do existing hospitals, other than Joint Commission, which are very vague rules, how do they staff? I work in an outpatient clinic, so I don't know how they staff. Do y'all know?
I think it's by acuity, and honestly, I think a lot of it is software based.
And it's just like, oh, I think we need 7 nurses here,
Based on what their acuity is, what the the staffing mix looks like.
And that's another thing. Like, I know, like in my previous unit, it was a paper like acuity score, but like what it takes into doesn't really, like one patient could be like the highest acuity, but really they're the easiest patient on the unit, while someone else is the lowest and they're really the most challenging patient on the unit. So
if there's behavioral or something.
Exactly.
Yeah.
Like they may need one-on-one, like someone to sit in there with them. Yeah.
Okay. So
or they could just be.
Activity scores are challenging too. They have
they could, be refusing their medications, or it could be anything. So there was another part of that was the restrictions on the mandatory overtime or overtime. I don't know if we want to get into that at all, but
I mentioned that when I was writing in that first introduction deal. I mentioned that as kind of a resource that they've been using since we don't really have anything right now, like that was just kind of being implemented on a hospital basis, like per hospital basis, to decide if they want mandatory overtime. That was really the only resource, if you're looking at the rubric program, to address the problem.
Yeah, the only way, I've seen how that fits in overtime, not like, okay, you're working late today or someone called out or whatnot, but if you're working, I know at my place I worked really hard to eliminate doubles, so when I came in, they were still working double 16-hour shifts, and definitely with that ratio, say you have a ratio of the 1 to 7, you're working 16-hour shifts, you're definitely, that's absolutely affecting your quality of care and your risks for medical errors, et cetera, et cetera. So I think, if your ratio is lower, not to say that working 12-hour, 14, 16-hour shifts are great, but it makes it a lot safer if you have that lower ratio as well.
And there's so much research on that. And we were also included in that introduction. She told us to go patient safety. Me and Mandy were talking about employee safety.
Mm-hmm.
And so I actually found an article that said, like, OSHA reported 30% decrease in workers' comp claim injuries whenever they had more staff.
Mm-hmm.
So
yeah, because otherwise you're just relying on the agency nurses, which are, nightmares as far as their hours. They can be working anywhere from 40 to 90 hours a week. You have no clue who's coming into your facility, where they came from. They could just be coming off a night shift.
Or they just get tired of working, and so they get an injury, so they get to go home. And they're not, don't think I'm kidding. This happens.
Yeah.
This happens. Well, there's like, yeah, it does.
Yeah.
It does. I'm working on an injury right now. I just want to tell you, I'm just playing.
Oh, I was about to say.
I'm telling you, we've been having this overtime issue, and we're getting all the micro from the West Coast because they decided to shut our lab down in the West Coast, their micro department. So it's been a rough week for me. So I've already reached out to my stakeholder, by the way.
Oh, look at you.
Next week is going to be even worse for me.
Crazy. Yeah, crazy. Let's
When do you guys want that grid then? For how soon are we putting that together for the stakeholders?
Maybe we vote Levis does that, since he's far more technologically inclined than we are.
Okay.
And then he can do it, because he did it like right after the meeting last time, so maybe he just does it again.
He did it during the meeting. It was ridiculous.
Yeah. I think he did it from his cell phone. Like, I don't even know if he can do it from his cell phone. So Ladere, we were kind of finishing up our two alternatives, and see if you're cool with them. And it's basically pretty much everything we've talked about for the last 3 weeks. But Mandy, and I think Jocelyn's going to submit the assignment, but if y'all want to kind of fill her in so she knows what we're talking about.
Mm-hmm.
Yeah.
Yeah, it was just going off of that document we talked about last week. So, Mandy was just focusing on, it looks like page 21 to 23, where it talks about state action. So having nurse-driven staffing committees, having nurse-to-patient ratios by specialty, and then disclosure, making full disclosure to the public regarding those staffing plans, so that they're held accountable for their ratios.
Okay.
Trying to think what else. So
like alternative, like the status quo is like we just talked about with the professor. We don't have one. Number 2, we're going to put that we're going to require a ratio of 1 to 2 and 1 to 4 for patients to nurses on ICU, ER, telemetry, and pediatric units.
Mm-hmm.
That's regulated by the DHH, Department of Health and Hospitals. So we figured like super strict, because she talked about political viability, like if we gotta maybe have to like bargain, so we go in hard and then maybe back off if we need to. And then the third one would be a little looser. What was it? What'd you say it was, like Missouri, Jocelyn? What was it? Who did that one?
Illinois? Is that the one you're talking about with the law for hospital staffing?
The one of it's like the committees.
Yeah, it's Illinois. There's actually a couple states that fall into that, but Illinois does both the disclosure of staffing plans to the public and the nurse-driven staffing committee. So
basically, what our second alternative would be is to suggest that each hospital has a committee comprised of 50% active nurses that make the staffing protocols, and that they have to publish their ratios. We'll say annually or quarterly.
Gotcha.
So
Okay.
Those sound like suggestions you can get behind?
Yes. The stakeholder that I reached out to for the Louisiana Alliance of Patients was Flip Rogers. He's the VP of Clinical Services. And he basically talked about the ratio of 1 to 4, if just on the regular ward, and 1 to 2 on ICU. He said it just depends on the acuity, like we've been talking about as well. He
was for it? Like he was cool? Like he was like, yeah, it's a great idea?
Actually, no. He said if you want to focus on something, you need to focus on the quality of life of our nurses. Because
well, that's part of it.
Mhm.
Right. But he said the problem in Louisiana is, according to him, last year, 1,400 applications were turned down because Louisiana does not have the funding for like the nursing school. They don't have the staff to meet the needs to teach the nurses.
Mhm. Well, the teachers are getting paid less than, you know,
Far less than nurses.
yeah.
Right. So
But
that
I
was
think
one of
Katie
the
brought that
barriers.
up last week too.
Yeah,
Yeah.
and that was one of the barriers that
Yeah.
one of the barriers that he saw with the staffing. He said Louisiana is not turning up enough nurses.
Yeah, and it goes
So
back
would
to
you vote
the
for
funding
it?
from the state. Like we're cutting higher education, which is where a lot of our nursing schools are. I mean, I went to public college. I know UL, LSU, Southeastern, all those in Louisiana, Nichols, they're all public colleges and they all have nursing schools. So they're losing funding, losing teachers, losing nurses.
Let me put it this way. I went to LSU and the football team had to give the school money.
Yeah.
If that tells you anything.
Oh boy,
It happened, I swear.
that's messed up.
So he wouldn't vote for it? They wouldn't be for it?
No, he said he wouldn't be for it.
Did he have an like alternative suggestion?
Not
Or
really.
was his alternative that we needed to be more teachers?
Address higher ed.
Well, he made it clear that he did not want to speak on behalf of, Louisiana Alliance of Patient Safety. However, he wanted to speak as a physician of, primary care physician of 40 years. That was his thing.
So what does he care about patients?
maybe
What does he care about higher education, nursing shortages? If you're a doctor, you don't care how many nurses you have. You expect them all to do everything.
Yeah, 40 years ago,
Oh, yeah.
Right.
all different.
What else did he say? I have so much stuff.
So interesting.
Talking. His thing was, he said, if you want to focus on something, hospitals are trying to reinvent themselves. He said patients are more in charge of their care at this point. So he was like, hospitals are losing out. He talks about telemedicine, and I thought that was funny because that was one of our choices in the beginning. So you have to think about the technology that's going on right now, and things of that nature. So he was like, I think you have to take your focus elsewhere instead of trying to mandate. Oh, thank you, sir.
Well, you're like, well, this is kind of a project, bro, so help us out.
Thank you.
I don't know if this can fit in anywhere, but so I do work in telemedicine, and one of the things that we just implemented at one of our facilities, it's like a pilot program, but it's called Virtual Inpatient, VIP, and basically there's a computer in every room, and it has a camera on it, and the nurses are in a bunker, and they do all the admits, all the discharges, all of the patient education. They're monitoring the lab. So people have heard of like EICU, and so where they're monitoring like the critical care patients, monitoring rhythms, like things like that. So this is for like telemetry or like med surg units, so that it gives the nurses more time to focus on like medications and
The
safety,
care.
things like that, and actual care. So that's just like a side note. Like, I don't know if there's any way to bring that in. There's also no like, we wouldn't be able to like reference it really. There's no like citations unless there's I know we're not the first in the country to do it. I think there are other like companies that do it. So we could consider something like that.
And that might be something that in the staffing committee, that those are the kind of things they're talking about and creating plans around, for those kind of initiatives.
Honestly, because the meat of this is going to come from what we put under the alternatives. So I feel like whoever does that maybe you take that, Mandy, and you maybe incorporate it, because you're going to have some meat in those to get 10 pages.
Yeah.
So
I'll look and see. Like I said, we just launched this program like 5 months ago, so we don't have any we haven't put out any like research or anything yet, but I would imagine that there are other companies doing this. And then it brings nurses back, because then they're not at the bedside. They're getting to sit in a bunker and do education and other things. Like older nurses are coming back and wanting to do this because they can still do something and still do shift work, but not having to move patients and turn patients and things like that. So I don't know. I think it's something to consider if we really do need to add something in there.
Or maybe we talk about that in the stakeholders group and you bring up, that he mentioned this, and you could kind of like maybe tie it back to alternative 2, and say like, maybe this could be something we could consider.
Yeah, and he brought it up, so it's a good way to.
I'll say it, right? I'm impressed that he responded.
I know. I'm so worried mine's not going to respond.
Left him a message. At first, Angela, whoever she is, answered the phone, because it's a part of the Louisiana Hospital Association. So I was like, ooh, we might get the same person. I'm thinking, is Hannah going to have the same person? But, I don't know.
That's pretty awesome.
She probably gets, probably 4 calls a month about.
I was thinking he's probably not the highest sought out person in the hospital association, so he may was like, yes, someone cares. Got a captive audience.
When I first called, he was like, well, I have a national conference that I need to go lead, so is there any way that you could call me back? Sure. So I called him back when he asked me to at 3:00, and he didn't answer. So I left a voicemail. So hopefully he calls back. He called me back within like 10 minutes.
That's amazing.
He just wanted to tell you that he was leading a national conference.
Put that in your paper.
Yeah. I'm sorry, you're just a peasant. I've got other things to do.
Yeah.
But in no way am I speaking on behalf of the Louisiana Alliance.
Well, at the end
Oh,
of
yes, come on.
when we publish our paper at the end of the class, he'll have.
We won't quote you, but we will. Right. Don't worry, no one's gonna read it other than for a grade. Don't worry. Okay, well, I think that's great. I think we're really kind of on track. I guess we kind of need to start looking at writing. I really think we need to start that because there's, I guess Jocelyn's still okay with doing the assignment for this week.
Yeah.
Posting that. So she'll take care of that. And then we need to look at kind of starting. Do we want to start divvying out spots, or like we need to send an email that everybody needs to start contacting their people?
Yeah, and I think we need to try and set some sort of deadline for that also. I know tomorrow is already Friday.
For the stakeholders, you mean, or just for,
Stakeholders, yeah.
Make sure everyone understands that if you don't reach your stakeholder that you initially tried, that you need to attempt to figure out another stakeholder and reach out to them.
It's about effort here.
Yeah.
Well, it looks like next week and the week after are very light in assignments. So maybe that would be a good period of time to start, doing the stakeholders and contributing some information.
Well, I think
we don't have to do another recorded team meeting, but do y'all want to do another one to talk through the stakeholder piece, just to make sure see where everyone is, and then kind of be able to kind of bring it together.
And I think if we put the Google Doc, then as we start writing, we put it in there and we do a meeting, and we can actually pull up the Google Doc while we're talking. So if there's any issues or anything, we could do that.
So that link that he sent is the Google Doc for our paper?
Yeah.
Yeah.
So we just put that in the browser and it's there.
Don't ask specifics. I'm not really sure.
How do you save it?
Google how to use it. I don't know.
It probably saves itself if it lives in the cloud.
That's
You don't even have to save it.
A 10-page
You're the
paper, I don't know.
like my grandma, the cloud, it exists out there.
I don't want a 10-page paper going off into Google land. I don't know. I'm too.
Look, I'd write it by hand if I could.
Well, I'll let Levis explain it to us, and maybe he can just send a little email about how to operate it and what we need to do. But yeah, it's another video just for our own sanity to make sure we're getting everything covered here.
So do we want, okay, so you're going to take care of the assignment. So do we want to start assigning parts? I'm okay with helping on other sections, even if I've already done the first part, or if y'all want to scrap the first part, I don't care. I just figured it's worth getting started.
Yeah.
Maybe whoever submitted the weekly assignment can just cut and paste it into there. At least we have something to work off of.
Well, what I'll do is, I don't want to put it in the Google thing. I guess I'll post it in our forum, like the introduction page. It's like super rough, so like don't take it as it comes. Like I literally just have like links to the stuff I was using, but I'll post it so y'all can look at it. And then, because it's about a page and a half already.
Mm-hmm.
So do we four want to do the alternatives since we all talked about them?
That makes sense.
I mean, that would make the most sense.
Yeah, and I think with our, just our backgrounds here, I think we have plenty of information to put into that section, so that makes sense.
Okay. I mean, someone's going to get it pretty easy with the status quo. Someone's going to get it pretty easy. So y'all, I guess, decide who wants to do 2 and 3. I mean, I'll do 1 if that makes it easier.
Yeah, I mean, I can do either one. I can do 2 or 3. I don't care.
And just give me which one you don't want.
All right. I can do 2. The California one, right? Is that what that is?
The first alternative?
With the ratios, you mean?
Right.
Okay. And then I'll do the staffing committee and the staffing plan section.
So you're
With
so then, Ladera, you get the status quo. You get the easy one.
Great.
So,
Thank you.
You're gonna type up the paragraph for the assignment this week, and then we'll go from there and elaborate? Is that what we're gonna do?
That sounds good. Yeah, because I have enough tonight to put together for the assignment, and then I'll send it out as a draft, let you guys take a look at it, and then maybe we can then in our next meeting decide, or through text or something, decide how we want to add to those areas.
Okay.
Oh, you know what we got to talk about too?
Evaluation criteria. What did we choose again?
We chose the administrative or whatever it was. The one that we could use the measures for patient safety. That one.
And then we had one that we had to use, right?
Yeah, let me look them up real quick. Evaluation criteria. We have to use, let's see, I've got the slides right here.
Oh, yeah.
Economic and political, right?
Yeah, I think we have to use economic and political, and then we were going to do technical feasibility.
Right.
So in each of the alternatives, those 3 need to be addressed.
I'm sorry, economic and political, and what was the other one?
Technical feasibility. So I guess, and we chose it, I mean, because it asks you, why are these good choices for your project? Why did we choose this criteria? And I would say because we could actually have measures, like we could actually measure success of it through like medication error declines and patient falls and stuff like that.
Do you want to take that part?
I think it's all part of one. Like I'm afraid if we start cutting and slicing and dicing. Oh, you mean like the why we picked it?
Yeah.
Oh yeah. I'll do that.
Okay. So maybe that's what we need to do. Maybe we need to use this Google Docs, literally paste this rubric with the section of the paper, and then like under it put who's going to be responsible, and then put the chart in there that we want to use for the stakeholders with all the columns that we need filled out.
You think Levis could make that chart? I feel like he's far more advanced than we are.
I believe he could.
Okay.
I mean, I don't know him very well, but I think he can do it.
So far, he's impressed me with whatever he's done, so. I just know that we can't. Okay, so I'll do the,
And then we could just put in our references too at the very bottom. Just start
Yeah, just-
building that up.
and it's APA style. I mean, you could use, you know, it's easy. So then I'll do the why we chose it. Well, Daria's gonna do the status quo. You got number 2 and number 3. So then, I mean, really that pretty much like most of the paper. I mean, and then if we use a chart for the stakeholders, that's very little we have to write. Other than the lessons we learned from the stakeholders.
And maybe that's what we can do next week or whenever we can come together. Whoever's going to take that section, we each kind of talk through what we got from our stakeholders. Or I'm going to be in Boston next week for a work conference, so I'm not sure that I'll be available, but I can type it up and send it to whoever if I'm not available for a meeting.
Well, if we don't have to do one, then we can do it when it fits everybody.
Yeah. So,
Or if we don't do one next week, then we just do like one maybe like Sunday night or something.
mhm.
I mean,
Yeah.
that's
And I think we need enough time for people to reach out if they don't get a response to be able to find someone else.
So do we think we can have the alternative paragraphs done by like this time next week?
Yeah.
You think
Yeah.
that's feasible?
Mm-hmm.
I mean, so if we have it done by next week, then that's section 1 and 2 done already. And then that leaves us, what, 2 weeks for the stakeholders and the conclusion?
Mm-hmm.
Yeah.
Is that right? I don't have the syllabus for it.
I might be more like June 17th, 18th. Be able to plug in my information for the alternatives just because I'm taking that economics class and it's horrible.
Oh, I heard the teacher is really rough.
I just don't even know.
So we're about to run out of time. Our thing's about to expire.
So looking at that, I'll plug mine in towards the beginning of the following week just because of that reason, or else it won't be very beefy. So I'll delay that.
Look, as long as it's done by the end of the class, I don't really care when you do it.
Yeah.
Yeah. And like, look, if you have stuff going on and you just want to put like some stuff, I'm happy to help beef it up too, because
Me too.
yeah.
So that works. Okay, well, I know we've got a plan, so we've got alternatives. She's going to do the assignment for us this week. Ladaria, do you want to reach out to the group and just kind of do a summary of what we talked about? Just Levis, do the chart, explain the Google Doc to us.
Yes.
And then I'll post our meeting points recording.
And
And
then
Ladaria, you were on the call with the professor, so you know all the columns that we pretty much need to include for
The chart.
the chart. Yeah, thank you.
put that in the discussion board, you mean? Put that in there somewhere?
It doesn't matter. The forum or whatever. It's whatever.
Okay.
Cool.
And just curious, where did you find the link for that meeting we just had before this one?
It came up in my messages.
Yeah, and I got an email with it.
Yeah, it was weird. It wasn't in like a place that I normally ever look.
Huh. All right. Yeah, I could not find it anywhere.
Look
so.
up at the very top right-hand corner. There's a little blurb. It looks like a text message bubble, and that's where I saw it.
Oh, geez.
Yeah, it was very small.
All right. Well, I missed it.
It was so quick. It was fun.
She was
All right. I'll send out this draft probably Friday or Saturday morning at the latest
awesome.
for the assignment. Yep.
Sounds
Yeah,
good.
we'll be able to go back and look at the video that we have with the professor.
I don't think she recorded it.
Yeah, it was her.
People out of my office at the time, so
Like a live
Um,
meeting, I guess.
I would just do like who you contacted.
I can send that out. I can send the different columns.
are you sure?
Yeah, look, if you wanna I'll either respond, or if you send it, I'll respond to you on what the columns need to be. Yeah. Okay.
Go team, go. All right, guys.
Bye-bye.
Have a good weekend. Bye.
Thanks. Bye.